All right, welcome back to the show here on TTT. It's time for a spotlight interview. And over the last couple of days, we've heard of the amount of deaths from COVID-19. November being one of those records that we've had in terms of the amount of deaths. I think it's 138 or 132 for the month of November. But anyways, we're talking about the funeral homes and their ability to deal with the capacity to treat with them number of deaths coming out of COVID-19. So let's welcome to the program at this time David Simpson, Managing Director of Simpson's Memorial Service, and Luigi Jordan, who is Operations Director for Clark and Batu Limited. Good morning to you, gentlemen.
Pleasant good morning, Natalie.
Thank
Good
you
morning,
so much.
Natalie,
Good
and your viewing
morning.
public.
Thank you so much for joining me this morning. So, Mr. Simpson, let me start with you. With November, with the month of November, and with the increase that we've seen in deaths, how are the funeral homes treating with all of the deaths? Are we able to deal with the amount of deaths that we have coming out of COVID, or do we need more capacity?
Good morning, Natalie, again in Trinidad and Tobago. At this time, I believe the funeral homes are coping quite well. I don't necessarily see the need for more capacity. What we need is better protocols and faster turnaround times. But outside of that, I believe my colleagues in the industry are doing quite well.
And when you say protocols, what exactly are you talking about? What is it that needs changing?
Okay, we have the registration process where we need to have the death certificates registered. That is now given to the funeral home once you die from COVID-19. However, we still have to operate within the public system, and it's not always as smooth as it should go. You know, I believe once the death certificate says COVID-19, that there should be a next in line process where once we present or we get to the area where that is being processed, that priority should be given so that we can see faster turnaround times.
And Mr. Jordan, let me bring in on the conversation. What is the turnaround time that you all are experiencing now, and where do you think it should be?
Well, let me just give you an example. Husband and wife, no children. Husband has passed away from COVID. Wife is under quarantine. Nobody's around to run around to get the documentation done. We have to wait until the wife is out of quarantine. Let's say the wife, it takes a turn for the worse and passes away as well. Major problems in trying to get that documentation done to have this person's loved one buried properly.
And
so far, I have had situations where it took, let's say, up to 2 weeks to get the documentation done properly.
And in such an instance, Mr. Jordan, where you have, let's say you don't have any children and both husband and wife are deceased, how are you able to get that documentation so that you can bury the dead?
Well, you look for next of kin as a brother or a sister. If sometimes that person is away, not in Trinidad, they have to sign some sort of affidavit allowing us to go ahead and try and get the documentation done. It's a bit tricky at times.
It is sounding very tricky. What happens to that body? How long is that body delayed before it's buried?
Well, as I said, in my instance, I had up to 2 weeks waiting to get the documentation done.
And Mr. Simpson, how long is it recommended to keep a body that has someone who has died from COVID?
Well, the protocol from the ministry at this time is at least 3 days. So within 3 days, we need to have the paperwork done, have the funeral, and that loved one laid to rest. But as you see clearly, based on what my colleague is saying, the problems that we experience is not always that simple.
And what are the risks associated with having a body that someone who died from COVID being in the system for so long, for more than the recommended 3 days?
Well, I mean, once you keep your protocols the way that the WHO, the government, the Ministry of Health has asked us to do, and then with the training, the classic training that we have, This is not really about the spread because lately the WHO has put into um, their discourse that bodies staying more than 2 days in proper refrigeration, the disease, as it is, passed off. So it's not so much transmissible anymore. But our government, our chief medical officer, wants to make sure that no mistakes, there are no negative outcomes. So it's still 3 days for disposal at this time.
Hmm. So you're saying that according to the WHO is that the body is no longer able to transmit COVID after 2 days?
That is the information that we are receiving right now.
That's very interesting. But as you said, we have our own protocols here just to ensure that people are safe. Mr. Jordan, have we been having any outbreaks of any sort in funeral homes, as far as you're aware, as a result of treating with COVID bodies?
Not that I'm aware of. The thing is, most funeral homes, we operate at a standard that I guess they will operate at the hospitals. We have all PPE equipment. Most of us will have sanitization, temperature checks. We have put all our checks and balances. OSHA has visited us. We have followed their guidelines, and I think most of the funeral homes have complied.
Right. And I see that this weekend, as reading in one of the dailies, where one of those funeral homes is saying that they believe that they should open it up to other funeral homes because one of the criteria is embalmment. But, bodies that are deceased, people who have died from COVID-19, there's no embalming going on. Do you believe then, under such circumstances, that other funeral homes could be brought on board to treat with COVID bodies?
But it doesn't have anything really to do with embalmment. Is having the professional training on how to deal with cases as we are in a pandemic. Um, I guess, operators have not gone and done the training. So when they get a COVID body, they would not know what are the protocols to follow. Yes, we have guidelines through the Ministry of Health, but not all funeral homes is following this protocol because some bodies are being dressed and viewed.
And is that supposed to happen?
No, according to the Ministry of Health.
So how do we treat with this, Mr. Simpson, when we have these kind of breaches where people are dressing bodies and viewing bodies, considering that you're saying that WHO is saying, after 2 days, the possibility of transmission is probably non-existent or very low. But even so, why are we having these breaches to the Ministry of Health's regulations?
Well, Natalie, this is why the Association of Funeral Professionals of Trinidad and Tobago has approached the government and has had a commitment from the Attorney General's office that our industry should be controlled. And there will be certain protocols and certain qualifications necessary for one to operate such a funeral home or such a business. Now, right now, in Trinidad and Tobago, you could basically have a flush and sink, and technically you have a funeral home, right? And that's not what it is about. First to begin, the training is what is necessary so that you will understand how to deal with infectious cases and how to deal with all cases, regardless whether it be SARS, COVID-19, Ebola. You have that classic training. So you're not bringing any sort of transmission to your employees or the public. And this is what it is about. It's about being qualified, being trained in this industry so that the operation does not interfere with public health. Those of us who have entered mortuary college, the first thing they tell us, we are protectors of the public health. Somehow in the Caribbean, and it's not so much happening because there are those of us who took the time to went and become qualified and classically trained, while others just jump on the bandwagon. They would have worked with one of us for quite some time and believe they have the knowledge and they try to attempt the same thing. And then we have breaches in public bodies being exposed and transported in vehicles uncovered and stuff like that. So This is why we ask the government to regulate our industry so that we're able to have better control, especially
Right.
in times of pandemic.
And I think that is so important, as you said, to have that training to deal with infectious diseases so that we can really be in charge of the public health, as you see. But Mr. Jordan, let me bring you back in on the conversation. Have we seen a decrease in the cost of funeral services, or just treating with the body? And I ask because one of the fundamental differences I've noticed here is that in Jamaica, regardless of how long a funeral home has a body, the costs remain the same. But I don't think it's the same here. Have we seen an increase in the cost or a decrease in the cost for burials of those who die from COVID?
Well, Natalie, to stick to the Ministry of Health protocols, staff members who's going on a removal, they have to put on the PPE equipment when they do the removal. When we get back, they have to put on PPE equipment again. The vehicle has to be sanitized. This is following the Ministry of Health guidelines. All these things would have a cost. And that cost, of course, has sent the cost of funerals up a bit. Not much. Some funeral homes try to keep it as reasonable as possible. Some funeral homes, it's a free market. They could cost the way they want to cost. And I think that's what the family members, some of them complain about.
Right. But I mean, if we're looking to regularize the sector and to have that kind of control, isn't this something we should look to control as well? Fully understanding that being in the midst of a pandemic doesn't only mean, the risk of death, but that there are economic hardships.
Well, that is exactly what regulation will do. Once we have licensing laws, they will also have discussions pertaining to prices, and it should have standard prices across the board. There may be small variances, but not much.
Right. And Mr. Simpson, when it comes on to, treating with people who have died from COVID, somehow I can't seem to find the right terminology. All the whole morning are talking about this. When it comes on to treating with people who have died from COVID, how does the funeral home interact with the family members of those things? Because I know a huge part of it is the grieving process and to, kind of have this space which it comes down to the funeral home to get that kind of closure, to get that kind of respect to the deceased loved ones. How do you all interact with family members?
Well, the interaction with family members of this time happens within protocol. So, of course, anyone coming to the building or coming to your funeral home, they have to sanitize. They have to take their temperature. These sanitizing stations, temperature check stations are in place. When they get to the funeral home, they should be wearing their mask. We are the funeral home. We try to sit 6 feet apart, following the guidelines. We still want to maintain that humane standard. We don't want to make anybody feel like, listen, we staying away from you. We don't want you to come to our place. No, there are the families who will opt to have it done through different media, where we can do a Zoom meeting, we can do a WhatsApp. It has been done. It is being done as we speak. So the families still feel some level of comfort. The guidelines has been relaxed to a point where we can have the pouch open and a picture taken so that the family could verify, yes, this is my loved one, and have some sort of closure without having the deceased fully exposed to the public.
Okay, so
So
no,
we still try
you're
to
not.
maintain that. Sorry, go ahead.
Go ahead.
Right. So we still try to maintain that humane factor, make everybody all inclusive, right? We don't want to make anybody feel like, listen, we don't want your business or we don't want you, right? Because at the end of COVID, we all still have to live and interact, right? So what we do is follow the guidelines to the letter to make sure there's no cross-contamination, but we continue as normal.
And Mr. Jordan, is it that now that when we're burying people, we use PPP for everybody? Because the thing is that somebody is not declared deceased, deceased from COVID, doesn't necessarily mean that it may not be so.
Well, no, you don't really have to use PPP for everybody, because what has happened, the COVID disease is normally in a sealed body bag. It's placed in a casket, and that casket is sealed, and then the casket is sanitized. We don't encourage touching or anything like that, but the people who are attending the funeral, once they keep the social distancing aspect in place, that will be fine. I could just add though that our population right now, I guess, throughout the world, we we're going to get a very sad future population because people are not getting to carry out the celebration of someone's life, and that's what the funeral industry is about. They're not being able to gather. Sometimes we say we meet people more in weddings and funerals. That is not happening anymore. So people are not getting to celebrate the life of their loved ones the way that they should.
Right. And I guess that definitely is a sad, sad situation for those of us who have to deal with this kind of trauma. Mr. Simpson, final comments before we go?
Oh, well, Natalie, I would like first to ask Trinidad and Tobago to please be responsible in their actions as they go about their daily activities. You know, wear your mask, sanitize. We now have a new variant, the Omicron, which is now in the African states, and pretty soon, you know, it's going to reach our shores. Let's make sure we go out there. The government has provided free vaccination thus far. Let's take advantage of it. Let's encourage each other to, you know, look at the information that is out there and make their own decisions. Don't be frightened or fooled by persons who think there is some sort of underlying situation. I mean, I would not want to have to come to your house unnecessarily 2 and 3 times before the actual time. So let us all sanitize, let's follow the guidelines, and let's live love in Trinidad and Tobago.
All right, Mr. Jordan, Mr. Simpson, thank you so much for being with us here this morning.
Thanks for having us.
You're most welcome. Guys, want to think?
Yeah, I mean, and they have a task ahead of them, for sure, definitely. And they've been going through it for the last, 2 years, so, you know, and especially when it comes to the risk, I think it's a big factor that they have to be firm and deliberate about. I do have a concern when it comes to how many other funeral homes have been popping up. I do know that I've heard people talk about the challenges that they face at the hospital when it comes to people seem to be, what's the word they're looking for here, touting?
But you can't tell, but the thing is that when it comes, you have touting all the time. I've literally seen it with my own eyes in Jamaica, right? Touting for body. Like, Mr. Brown driver and asks, anything for me today? Anything for me today? But apart from that, is that the Ministry of Health has certain funeral homes that are registered to treat with people who are deceased from COVID. So there's some control. So whether you want to tout your son, you can't get a COVID boy.
And there's also been a challenge where people are saying that their loved ones had an issue at home and then they're reaching hospital, they're saying that they died from COVID, but they didn't have COVID when they went in. So it gets a little bit tricky and a bit more complicated. But we have a lot more in store for you guys this morning, so please stay tuned to our morning show. We'll be back after this.
Rembunction.